High blood pressure and you. High blood pressure is a health-related topic that is often discussed as a marker of health. But, first of all, what exactly does that mean? In this video we will go over the definition of high blood pressure, along with tips that can help you prevent potential health risks and live a healthier life. Simply put, blood pressure is the pressure that blood exerts on your arteries, which are responsible for carrying blood from the heart to the rest of the body. This is not a set pressure as it can vary throughout the day. Blood pressure is measured with two markers called systolic and diastolic blood pressure. Systolic pressure is the pressure on the arteries when the heart beats, and diastolic pressure is the pressure when the heart is in between beats. When a doctor or nurse measures your blood pressure and tells you that your blood pressure is 110/60, it means the systolic pressure is 110 mm of mercury and the diastolic pressure is 60 mm of mercury. So, what is considered a healthy number? Generally, pressure below 120/80 would be considered normal. Pressure that is above these values would lean towards high blood pressure, also known as hypertension. Unfortunately, there are often no warning signs or symptoms of hypertension, hence its infamy as a silent killer, so measuring blood pressure would be the best way to check. What contributes to high blood pressure? Lack of exercise, eating unhealthy foods, stress, and unhealthy weight gains can all contribute to hypertension. What are the dangers of high blood pressure? Heart. Constant higher pressure in the arteries can decrease the flow of blood and oxygen to the heart, which can cause potentially fatal conditions, such as heart attacks and heart failure. Brain. If the higher pressure causes arteries supplying blood to the brain to break or become blocked, then this can result in devastating damage to the brain, such as in the case of a stroke, and longer-term effects, such as declining cognitive functions. In some cases, the result can be fatal. Kidneys. Higher blood pressure has also been linked to a higher risk of kidney disease. While all of that sounds scary, here are some free solutions that can be used to reduce the chance of high blood pressure. Moderate exercise for at least 150 minutes a week or more intense exercise for 75 minutes a week. Quit smoking. Eat healthy diets that incorporate fresh fruits and veggies. Control your alcohol intake by having no more than one drink a day. Keeping a healthy weight for your age and gender. Reduce your daily stress levels. Take up meditation or deep breathing. Lifestyle changes may be uncomfortable, but they go a long way in improving your health and well-being. Plus, they're free. Take a few steps to improve your health so that you can spend more time with the people you love and have more energy to take care of the important things in life. We hope you've enjoyed this video. If you like our content, please like and subscribe so that we can produce more content with information and tips to help you lead a healthier and more energetic lifestyle. See you next time, Uplift Crew.